You've got some onesies, you've got some diapers, and you're here watching me, which I absolutely love. But how do you know that you're actually ready to have this baby? Today, we're gonna jump into how to know if you're really ready, what you can be doing to make sure that you're ready. And I think you guys are really gonna feel a lot more prepared as you watch this video. So let's get going. Before we get going, I have a whole third trimester prep pack that's gonna help you guys get ready. I'm gonna link it down below. It's totally free. Okay, the first sign that you are ready to have your baby is that you have taken a class. Notice I said taken. I didn't say just buy or enroll. You actually need to go and do the class. So many people just buy the birth class and then don't end up doing it. So I am here to encourage you to make sure that you actually get it done. This is why I don't recommend a birth class that has 20+ hours of footage in it. I think a good birth class can be done in about 3 hours. Make sure that you're looking for one that will fit your time frame. I have one that I recommend. I'm going to link it down below. Make sure that you're taking a class that prepares you for inductions, C-sections, epidurals, not having an epidural or natural pain management, as well as managing early labor at home. You want to make sure that you are taking a well-rounded birth class, not just one that teaches you some breathing techniques. Because the thing that I see people most concerned about actually in the labor and delivery room is making choices for themselves based off of the information that they have in labor and delivery. Taking a class that prepares you to do that is the big win. Okay, the next thing is to make sure that your partner is prepared too. Now, as someone who gets to see the analytics of people who watch my free videos, most of them are not men. So make sure that you're also getting your partner involved in preparing for their upcoming birth. Again, I recommend a birth class that involves both of you and helps prepare both of you. The one I recommend, I'll link down below, but make sure that your partner is also getting involved. In fact, I see a lot of people who purchase or enroll in a birth class, and then just the person who's giving birth takes the birth class. And that's not helpful. You both need to have some skin in the game because it's gonna give them some skin in the game once baby's out as well. And you definitely want that. And in fact, this whole video is a post on my website. I'm gonna link the full post down below in case you want more information. Now, one of the signs that I think you're ready is that you are ignoring social media. I think one of the signs of not being ready is that you are rapidly trying to consume information on social media. I'm here to tell you that social media can be helpful. However, it is often just a small part of a very big story. So when you understand the whole story, you're much less likely to need all the tiny bits of the story on social media. Of course, they can add to your knowledge and things like that, but most people who are actually ready for their upcoming birth are ignoring social media on pregnancy for the most part. Now, here's one you're absolutely gonna hate, but one of the signs that you are ready for your upcoming birth is that it is your due date. Now, one of the trickiest parts of pregnancy is that I encourage you to be ready by about 34 to 36 weeks of pregnancy, but then also plan to not have that baby for a month or plus after you're ready for the baby. You wanna make sure that you have that car seat. You've taken the basics of your birth class. You want to have all those things done early, just in case baby comes early, but then also not be so anxious the baby needs to come right away once you're prepared. So remember, you're looking for your due date, possibly after your due date, not just thinking at 37 weeks you'll likely go into labor because someone, again, on social media went into labor at 37 weeks. Most people have their baby after their due date if they are not getting induced. Now, here's one so many people miss, and it is practicing these things daily. Now, in my birth class, I teach breathing, but I don't give you hours and hours of footage because I encourage you to practice breathing throughout your day. You get one of those tough ligament pains, that's a great time to practice your breathing. Practice relaxing even though you're in pain. You guys are stuck in traffic. That is a great time to practice your breathing together. You can stay calm in the traffic. Also practice for labor. Honestly, labor breathing is a great way to manage your stress, and you have a lot of stress coming up towards this baby. So make sure that you are practicing it all the time so it really gets ingrained in your system and you're really prepared to use those tools when you are in pain during labor. Now, here is a bonus one for those who are planning to breastfeed. If you really want to breastfeed, I 100% recommend taking a short breastfeeding class. The online prenatal class for couples actually includes a short breastfeeding class, but if you're really concerned about breastfeeding, they can actually do prenatal breastfeeding consults. I'm actually not a breastfeeding expert. I have helped with breastfeeding, but I recommend the Breastfeeding Mama, and she does do prenatal breastfeeding consults that can be covered by insurance, so check her out. I'll put the link for her down below as well. Breastfeeding tends to be an area that snags a lot of people postpartum, and I think if you have some education on it in advance, it can really help breastfeeding go better. Now, people are making lots of mistakes in their third trimester. I actually have a whole video about the mistakes people make in their third trimester that I'm going to link up above. How prepared are you after watching this video? Tell us down in the comments, like on a scale of 0 to 10, how prepared you are. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.